Dr. Mara Sunderland first found the red leather folio while inventorying the forbidden section of the hospital's pathology archives. It had no catalog card and no barcode, just a smear of wax where a seal had once been, and a faint smell of camphor that reminded her of antique funeral parlors. She cracked it open, expecting 19th century sketches of gallstones or parasitic worms, the ordinary curiosities of bygone anatomists. Instead, she discovered 26 plates, rendered in a draftsmanship so precise it made Gray's Anatomy look like a child's primer. Each sheet displayed an organ she had never seen on any screen, scan, or slab. The images glimmered with metallic inks, and beside every part, a teardrop-shaped sac behind the sternum. A lacy fan spread across the throat, a fibrous knot stitched to the heart, appeared elegant marginalia, lex atatis, cuneus affectus, velum anime. Even stranger were the annotations in English, as if a later hand had tried to translate the Latin. Chalice of awe, diaphragm of dread, valve of empathy. Mara laughed, uneasy. Invisible organs of emotion. A morbid fairy tale, she thought, yet her fingers tingled as though she had brushed an electric fence. Later that night, after the ore lights dimmed and the custodian's carts squeaked through the halls, she returned to her office with the folio under her arm. She scanned Platae Locus Pietatis into her tablet, then cross-checked it against every database she had access to. PubMed, JSTOR, Thesaurus, Anatomicae. Nothing. The plate portrayed a wispy mesh that nestled between the pulmonary arteries, allegedly regulating the capacity to recognize suffering in others. A device for compassion, drawn with such clarity she felt she could reach in and tease it free. Mara chuckled at her own fancy, but the idea clung like burrs to her thoughts. She was a thoracic surgeon who ran on curiosity, the way the hospital generator ran on diesel. The folio fed that appetite magnificently. 2 weeks later, a patient provided the catalyst for her undoing. Gerald Keane, 41, ex-Marine, arrived with stage 2 thymoma, compressing his superior vena cava. Resection was straightforward, but during prep, Mara's gaze drifted to plate 8 pulpedum memoriae. According to the folio, this organ, no bigger than a walnut and lodged behind the left upper lung, governed the emotional weight of memory. She imagined Gerald's flashbacks of Fallujah, the nightmares he mentioned while signing consent forms, the tremor in his hand every time a door slammed. What if she could ease that burden? What if she could peel away the seat of traumatic recall while excising the tumor? The thought was obscene, yet thrilling. A cure beyond any psychotropic, hidden right behind the pleura where her scalpel already needed to go. The operation proceeded with textbook elegance until she reached the thymus bed. There, between the pericardium and lung hilum, she spotted something that made her chest constrict. A pale, filigreed nodule glimmered in the surgical light, laced with capillaries, but possessing a distinctive sheen, unlike any tissue she'd seen. It matched plate 8 so perfectly that she forgot the hum of monitors, the weight of retractors, the anesthetist's breathing behind his mask. This was no fantasy scribbled by a Victorian mystic. It was real, nestled inside a living man. Her assistants saw only normal adipose wisps, their faces calm. Somehow the organ was visible to her alone, as though the folio had rewired her perception. Her hands moved with stealth she barely recognized. A microclip here, a cautery sweep there, and the nodule slipped free. She placed it in a specimen cup thick with formalin and finished the resection, telling no one of the extra harvest. Gerald's vitals remained stable. The resident attributed his slightly elevated heart rate to the expected post-sectement stress response. Mara closed, scrubbed out, and hurried to pathology. Under the dissecting microscope, the organ looked like a tiny brain tangled with silver threads. Standard staining revealed nothing. Slides came back ghostly, as if dye slid across hydrophobic glass. She resorted to electron microscopy, and the screen filled with fractal lattices that refused to fit any cellular taxonomy. She should have been frightened, yet awe burned brighter than caution. She labeled the sample adipose fragment and locked the slides in her office safe. Gerald awoke, extubated and alert. At first, he seemed merely groggy, but by evening the nurse called Mara to the ward. "He's different," she whispered. "Calm, but not in a good way." Mara found him sitting upright, eyes steady, posture too rigid. When she asked about pain, he replied politely, yet his voice lacked inflection, as if he read from a manual on bedside conversation. She tried a joke. He tilted his head, calculating. "Is that supposed to amuse me?" he asked, tone flat. The next day his wife visited with her 8-year-old daughter. The girl offered him a handmade card, crayons, hearts, glitter. Gerald stared a beat too long before saying, "Affirmative," and turning to the window. The child began to cry. Gerald showed no response except a faint twitch, like mapping data points. Mara told herself post-circuitive dissociation was common, but guilt pooled beneath her ribs. She scheduled a psych consult. The psychiatrist reported blunted affect, devoid of empathetic resonance, recommending further evaluation. Mara nodded gravely and said nothing about her secret specimen. Over the following months, Mara extracted 3 more organs from unsuspecting patients, each corresponding to a different plate. From an elderly woman with pleural effusion, she removed the chalice of awe. From a teenager with pectus excavatum, the diaphragm of dread. From a businessman with atrial myxoma, the valve of empathy. Each time, no one else seemed able to perceive the tissues. They glimmered only for her, and each came away with preternatural ease as if the body surrendered them gladly. Their absence, however, produced terrible side effects. The elderly woman no longer felt wonder. She described sunrise as an optical gradient. The teenager stopped fearing anything. He strolled into traffic giggling. The businessman, once charitable, became predatory in board meetings. Rumors circulated of aggressive takeovers and cruel layoffs. Mara watched their transformations with growing horror. She had not cured suffering, she had stripped humanity's ballast, leaving emptiness that hungered like a wolf. One rain-lashed night, unable to sleep, Mara reopened the folio looking for an answer. At the very back, she discovered plates XXV and XXV, glued together. Steam from the kettle loosened the edges, and she peeled them apart to reveal a hidden addendum, scrawled in rusty ink. Extraction fragments the anima. Reversal requires reimplantation or fusion coil. Do not exceed triad removal, lest the void propagate. Triad removal she had taken 4. A chill crawled up her spine. What was the void? Was it confined to individuals, or could it spread? Her doubts crystallized into terror when the newspaper printed a story about Gerald Keane. He had abandoned his family and enlisted as head of security for a private military contractor notorious for human rights violations. A photo showed him in tactical gear, eyes like frost. The caption read, "Keane addresses rumors of prisoner mistreatment." Mara recognized the predator she had helped create. She drove to the hospital, lungs taut with panic. She had to put the organs back, but she had not preserved them, only fixed them in formalin. Reimplantation demanded living tissue. Perhaps she could transplant from donors, yet how could she justify harvesting invisible organs from healthy people? Then an idea struck, sinister but logical. Take the organs from herself, fuse them, and graft into the victims. She would diminish her own soul to mend theirs. It felt almost redemptive. She booked an OR after hours under the guise of practicing an innovative anastomosis on cadavers. She recruited only one accomplice, her most trusted resident, Jacob Lynn. Brilliant, inquisitive, and, crucially, in love with her. Jacob would do anything she asked, though he believed he was assisting a cutting-edge immunology study. Mara anesthetized herself using a target-controlled infusion pump linked to her watch for automatic titration. While drifting into haze, she guided Jacob's gloved hands to the incisions she had marked on her thorax. "Follow the plates," she murmured, showing him in large prints from the folio. Jacob hesitated, scissors hovering above living skin. "These structures aren't in Netter," he protested. And then they exist," she gasped. "Just look." And, impossibly, he did. Whether love opened his eyes or the folio's aura spilled from the parchment, Jacob saw the glimmer. Awe widened his pupils. His doubts dissolved. He began to dissect with reverence, clips and suction precisely where she indicated. Pain winked through the anesthetic fog. Mara clenched her jaw, ignoring alarms that warned of hypotension. One by one, Jacob placed her chalice of awe, diaphragm of dread, and valve of empathy into chilled saline. When he prepared to excise the locus pietatis, she grabbed his wrist. "Enough," she whispered. "Try it only." She survived the procedure, barely. Recovery felt like waking under black ice. Colors dulled, music flattened. She watched Jacob pace, worry etched on his face, and registered his anxiety as data, not feeling. "So this is what I did to them," she thought, shivering. Phase 2 demanded she locate her earlier patients. The teenager and business magnate were local. Gerald was overseas. She began with the boy, Ethan. He had been admitted again. Motorcycle accident, compound leg fracture, perfect logistics. Mara petitioned orthopedics for surgical rights, citing continuity of care. She wheeled Ethan into OR4 at dawn, Jacob at her side. X-ray displayed femoral shards, but she plotted a second secret course. Restore his diaphragm of dread. She reopened the initial thoracic scar and found the cavity where the organ belonged, faintly luminescent like an outline waiting to be colored. She sutured her own tissue into place. When she finished, she repaired the leg with plates and screws. Ethan awoke screaming. Terror flooded him so violently the recovery nurse almost sedated him, but Mara intervened. She spoke soft words, describing night, pain, consequence. Gradually, the hysteria modulated to something like healthy fear. His eyes watered. He thanked her for saving his life. Mara blinked, tasting salt she could not feel. Buoyed, she scheduled the elderly woman Lillian Reeve for exploratory thoracoscopy to address lingering effusion. In truth, Mara implanted the chalice of awe. Post-op, Lillian marveled at the pattern made by sunlight on the curtain, tears sparkling on her cheek. She whispered, "I'd forgotten how beautiful simple things are." Mara nodded, mind gray but relieved. The businessman Marcus Dent proved trickier. He refused medical appointments, citing a hostile takeover deadline. Mara stalked him through news feeds until she learned of an investors' gala at a downtown hotel. She attended in a silver dress, clutching a scalpel disguised as a fountain pen and a vial of propofol in her purse. Jacob begged her to reconsider, but she insisted. Reimplant or risk the void growing stronger within Dant's sphere of influence. At the gala's height, Dant slipped to the balcony for a phone call. Mara followed, pressing the propofol-laced needle into his neck. He sagged. She guided him into a service corridor, where Jacob waited with a portable field kit. Under emergency lights, they performed a thoracoscopic insertion of the valve of empathy, while distant violins played Schubert. Sweat stung their eyes. Sirens howled far below. They finished just as Dent groaned awake. Mara whispered, "Remember kindness," then vanished into the fire stairwell. Dent's subsequent press release announced a sudden philanthropic pivot, profit-sharing, worker protections, mental health initiatives. The markets reeled. Mara's heart, what remained, measured the outcome statistically. 3 rescues accomplished, 1 still uncorrected. But Gerald was now embedded in a conflict zone on the other side of the world. Weeks stretched. Mara's own deficits deepened. She could not savor coffee, feel fatigue, or mourn the void inside her. Colleagues praised her unflappable composure. Jacob alone sensed the hollowness. He begged her to stop, to reclaim the final organ lest she calcify entirely. But Mara saw grim symmetry. 4 patients, 4 stolen essences. She must finish at any cost. Through discreet channels, She learned Gerald's unit escorted supply convoys in the Kivu. She volunteered for Doctors Without Borders mission under the alias Mary Sand. Jacob forged credentials and came as anesthetist. The rainforest heat pressed like damp wool. Rebel gunfire cracked in distant hills. In the triage tent, they treated shrapnel wounds, malaria, childbirth gone awry. Mara functioned with machine efficiency, devoid of compassion yet determined by principle. One dusk, rumor arrived. A firefight nearby, casualties inbound. Armored trucks rumbled to the gate, and Gerald Keene stepped out, dragging a bleeding teenager by the collar. The boy had stolen antibiotics, Gerald said. Discipline was necessary. His detached tone chilled even local militiamen. Mara asked to treat the prisoner. Gerald agreed, indifferent. While Jacob sedated the boy, Mara approached Gerald. Up close, she saw what she had wrought. Eyes like chipped obsidian, smile carved from absence. "Captain Keene," she said. "You're pale. Let me check your vitals." He scoffed, but orderlies with rifles considered her request standard. She led him to a curtained nook. Jacob slipped in behind, locking the canvas flap. Gerald sensed threat too late. Jacob plunged a ketamine syringe into his vein. Even in stupefaction, Gerald fought, shoving tables, roaring gutturally, sound void of rage, more calculated than frenzied. Mara tackled him, surprising herself with clinical aggression. They restrained him with straps scavenged from a transfusion stand. Field surgery lasted 40 minutes, Jacob pumping propofol while Mara reopened the thoracic scar. Sweat dripped into the cavity. Jungle's insects chorused beyond canvas walls. She inserted her locus pietis into its niche. Tissue melded, luminous. She closed quickly, adrenaline compensating for missing empathy. As the final suture tied, Gerald's eyelids fluttered. Tears welled unbidden, first he had shed in a year. "What have I done?" he whispered, voice ragged. Mara nodded, data satisfied. But the folio's warning returned. Do not exceed triad removal. Mara had, she was fourfold diminished, emptier than any patient she had maimed. Reimplantation into Gerald completed the reversal. Nothing remained for her. She swayed. Jacob caught her. "Now you," he said, eyes pleading. "I will give mine." "No," she replied, words echo hollow. "You must stay whole. Someone has to remember what we used to feel." Outside, artillery thundered. Supplies burned in the distance, and the humanitarian camp braced for evacuation. The void inside Mara whispered that survival was a calculation, not a yearning. She realized she could continue operate, innovate, prescribe, without conscience forever. A predator of scalpel and statistics. She shivered, recalling the folio's final note. Lest the void propagate. Perhaps the danger wasn't contagion, but the surgeon herself, carrying sterile absence wherever she worked. She opened her pack and withdrew the folio, pages brittle from travel. One by one, she fed them into the camp's incinerator barrel. Metallic inks flared green, then white, then vanished, ash spiraling with fireflies. Jacob watched, tears streaming. When the last page curled to cinder, Mara felt nothing. No regret, no relief, only algebraic acceptance. Knowledge surrendered is risk mitigated. Helicopter blades thumped overhead, ready to evacuate wounded. Jacob guided Gerald, still weak but humane again, toward the landing zone. Mara hung back, staring at her gloved hands. She contemplated following, but purpose had become abstract. Without the organs, she was an instrument, not a physician. Instruments belong in trays, she thought. She turned away from the lights and walked into the dark rainforest, where predators hunt by silence. Behind her, Jacob screamed her name until rotors drowned all sound. She did not look back, not out of resolve, for she possessed none, but because voids have no axis for turning.